What causes exploding head syndrome intensity? Imagine waking up suddenly to a loud bang that feels like an explosion in your head. This strange phenomenon is known as exploding head syndrome. It is a sleep disorder that occurs during the transition between sleep and wakefulness. The intensity of these episodes can vary greatly from person to person and even from one episode to another. So, what causes this intensity? First, let's talk about brain activity. Exploding head syndrome likely involves unusual activity in a part of the brain called the reticular formation. This area helps manage the switch between sleeping and waking. If there are disruptions in this region, it can lead to sudden bursts of neural activity that are perceived as loud noises. The strength of these bursts can influence how intense the explosion feels. Another factor could be minor seizures or overactive neurons. Some researchers think that small seizures in the temporal lobe or imbalances in electrolytes, such as calcium, might make these sensations feel stronger. This could amplify the experience of the explosion, making it more startling. Stress and anxiety also play a role. When you are stressed or anxious, your brain becomes more sensitive to sounds and sensations. This heightened sensitivity can make the imagined explosion sound more vivid and frightening. Plus, stress can disrupt your sleep, which may worsen episodes of exploding head syndrome. Sleep quality is another important aspect. Irregular or poor sleep, especially a lack of deep sleep, is linked to exploding head syndrome. If your sleep is broken or not restful, your brain may be more likely to experience these sudden sensory events, increasing their intensity. Changes in the middle ear or auditory system might also contribute. Sudden shifts in how your ear functions could affect how loud or sharp the explosion sounds. Variations in these ear-related factors can change the perception of the noise. Lastly, additional physical responses can enhance the experience. Many people report muscle twitches or flashes of light during episodes. These extra sensations can make the overall experience feel more intense, adding layers to the startling sound. Exploding head syndrome is a fascinating mix of neurological, auditory, and sleep phenomena. It shows how delicate the boundary between sleep and wakefulness can be. Understanding the causes of the intensity of these episodes remains a puzzle. However, the combination of brain activity, ear mechanics, and emotional stress creates a unique human oddity that continues to intrigue both scientists and those who experience it.